Alright, so thanks for joining me today. I will be performing a cranial nerve assessment, testing the integrity and function of her cranial nerves. I'll just begin by washing my hands, so I got a little bit of hand sanitizer over here. Let's place that on, all nice and clean. Second thing I'm going to do is explain my examination as I go through the steps, making sure that she's okay with them, asking for consent. So do you consent to this examination today?
I do.
Alright, and then if I was in a clinical setting, I would ask them to confirm some patient demographics like their name and date of birth, but I know her pretty well, so I don't need to go through that. The first thing we will start off with is cranial nerve 1, testing their sense of smell. So I'll have the patient close their eyes, and you'll hold up a scent that you know underneath their nose and testing if they are able to identify what the smell is.
It's a sweet smell, like a lavender or a lilac.
Alright, and that would be correct because on the bottle this is a lavender scented room spray. So you can just use anything around the house. You typically want to do something that smells good, because if you do something that is negative smell, could elicit a gag reflex, and that's not what the patient really wants. So you use something that smells good. The second thing that I will assess is cranial nerve 2. You'll do this, it's for optic, so the first thing I would do is have them do the Snellen test chart. I do not have one of those handy today, but I can go through the steps of performing that. You would ask the patient to cover one of their eyes, and there would be a chart 20 feet away, and they would read whichever line they could that's furthest down. So that would indicate their vision. Line 8, I believe, on a Snellen test chart is 20/20 vision, so if they can read that, they would be good. You would ask them to switch eyes, do the same thing there, and then lastly they would do it with both eyes open. And if all of the lines are the same for each test, then they have equal vision in both eyes, as well as when they have both eyes open. And if they have any correctional lenses, you would have them wear those during the examination. The second thing I'm going to test is the eye's reflex to light. So I would have a optic light. For this I'm going to be using just a little homemade candle here that we have. So it's something around the house that I found. I determined that it would work for this test. So you would have them be staring straight ahead, and then I would come into their field of vision with the light, testing that the pupil constricts, and when you bring it away, it would dilate again, as it did on this test. So you would check for equality on both sides, that the pupil constricts, bring it away, it dilates back out. So she passes the eye sensitivity for this test. The second thing that I would do is an accommodation test for their field of vision. So they would be staring off into the distance. I would place a finger up about a foot away, and I would ask them to follow my finger as I bring it in. You're looking for any astagmus, as it comes in that's uncontrollable shaking of the eye. You'll be checking that the pupils are crossing and that they begin to constrict as the finger gets closer and closer, making sure that the eyes are accommodating to that field of vision, which she passed for that as well. The third thing you could do is testing their peripheral vision. So you could place numbers in their peripheral field, making sure that they can identify what number you're holding up. So I will start down here.
4,
Go up here.
3, 2, 1.
And you'll test the 4 planes off in diagonal to the eye, testing for their field of vision peripherally. Cranial nerve 3, 4, and 6 are checked for with the eye tracking that I did, going from finger out here. You ask them not to move their head during this, and you'll bring the eye out, have them fall back in. And you're looking for astagmus again in the uncontrollable shaking of the eyes as you go into all 6 cardinal planes of vision. Last one. Perfect. Alright, cranial nerve 5, we are going to be testing the sensation of the face. So I will be palpating different areas. I'll have them close their eyes first. I'm just going to ask if the sense feels the same on both sides.
Yes. 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 Yes.
And then we will go through and test their ability to identify different types of feeling. So for this, I will be taking a pencil, and you'll have one end be sharp, which is where the lead is out, and a dull end, which is the eraser. You'll have the patient close their eyes. I'm going to, again, go in those same spots and ask them if it is the sharp or the dull end. So I will begin here.
Dull. Sharp. Dull. Dull. Sharp. Sharp.
She was able to correctly identify which end of the pencil I was using, so she passes that test. The cranial nerve 7 is assessed by facial movements, so I'll ask them to do a couple simple things. Can you just give me a big smile? Perfect. Can you puff out your cheeks? You'll ask them to hold that there, which she's able to do. Can I have you clench your jaw for me? You'll be palpating the masseter muscle and the temporal muscles, seeing if they are contracting, which they are, and then you could have them try to open their jaw against force. And she's able to do that, so she has good muscle function there. The next thing we'll move on to is cranial nerve 8, so I'll be testing her hearing. I will do this by slowly swiping my fingers together, asking if she can hear this on this side.
Yes.
Then we're going to test how far out she can hear it until it fades out.
There.
Do the same thing on the other side. Are you able to hear this?
Yes. There.
And that was about the same point on both sides, so she would pass for that exam. Cranial nerve 9 is next, so I will be doing this by viewing her tonsils. So again, I'll take out this light that I had, and I'm going to use the dull end of a knife here as my tongue depressor. If I were in a clinic, I would obviously have one. But I'm just going to ask them to open their mouth and say ah.
Ah.
I'm checking that the uvula rises when she does this. And then you also test their gag reflex. So I'm not going to poke around too much, but just kind of poking back there. And she had a little bit of gag reflex there. The next nerve that I will test is cranial nerve 12. So this is assessing the motor function of the tongue. So I'll have the patient stick out their tongue. And are you able to move it left or right? Can you move it up and down? She's able to do all those movements, so that nerve is intact. Cranial nerve 10, I will be already assessed through this examination. It's her ability to speak, so she's been answering my questions fine. And then also you can just have them do a swallowing motion, making sure that they're able to perform that. And the last nerve that I will test is cranial nerve 11. This is the accessory nerve. You'll be doing a couple different movements. So I will have the patient shrug up their shoulders against resistance. I'll have them turn their head against resistance. Again on the other side. Checking that she's able to go through the full range of motion and all the muscles are firing properly and contracting. So that ends our cranial nerve assessment. All of her nerves are functioning normally and within normal limits. So I will see you next time.